And welcome back. Well, today we're going to tell you about some of the latest beauty treatments.
Dr. Paul Loewenstein is here from the Greater Milwaukee Plastic Surgeons to talk about new advancements and treatments. Great to have you here.
Thanks for being back.
I bet if people meet you at a cocktail party or out and about, you get some interesting questions once you say that you're a plastic surgeon.
Absolutely.
What's number one?
What can you do for me? What can you do for me?
What would you do to change this?
Yeah.
Right?
Yeah. And that's a hard one because if they don't feel like they have something that needs changing, who am I to say you need this?
Right. I get that.
Classic example, someone comes in with a huge nose and you assume that that's what they're in for, and they're really in for a mole on their cheek, and you say, yeah, we can help your nose, and they go, what? What are you talking about?
I like my nose. Yeah,
you probably have to watch those conversations until you get the sheet or
you let them make the first statement.
Right, I get that.
Well, what's new? What's new in a lot of the advancements that you're working with?
Well, you know, it's February, and although it's terrible outside, everybody's going to start thinking about summer and bathing suits and that sort of thing. So this is a time of year when a lot of women start thinking about their bodies and breast implants and tummy tucks and that sort of thing. There's a whole range of implants that we have now available to us that we didn't just a few years ago. So, for example, the first implant was the silicone implant, which is shown here. And then the saline implant became very popular in the 90s because there was a brief moratorium on the use of the silicone implants. And then just a few months ago, this new form stable implant, it's called, was approved by the FDA for use. And the difference is that it has a teardrop shape, and it maintains that shape when you put it in the body.
Is it supposed to look more natural?
It can give a more natural slope to the breast instead of a more rounded look. Now, some women like the rounded look, but others want a more natural sloped look. And the teardrop shape is good for that.
Do you do reconstructive surgery like after someone's had a mastectomy?
Yes, yes. I would say 80% of the implants in this country are used for augmentation for cosmetic purposes, but leaves a good 20% or more, which is a growing number actually, for reconstruction. And I find that this implant is really good.
The teardrop.
The teardrop for the woman who's had a mastectomy with no breast tissue, and for reconstruction this works very well.
So what are we looking at here?
Well, this is the latest implant. It hasn't yet been approved by the FDA. It sort of has the best of both worlds in terms of silicone and saline. The advantage of a saline implant is that if there's a leak, you will know it right away because the breast will get small, whereas silicone is going to be contained by the membrane that the body builds around the implant. This implant there is a saline implant, but it's got baffles. It's nested so that the water inside flows more like silicone, so it feels like silicone, but if it leaks, you'll know it right away.
Okay.
In the next picture, it's a before and after of breast surgery that you do. So what's a common thing for a patient to say to you to get the after result that they're looking for?
Well, they want to be restored as nearly as possible to the way they were before. Sometimes if they're smaller to begin with, they might want to be a little bit larger, but most women don't want to be outrageous. They don't want to be tremendously different from how they started. This was an immediate reconstruction. In other words, the reconstruction was done at the time of the mastectomy. The first stage was to put in something called a tissue expander, which is a placeholder that also allows you to stretch the skin after the wound has healed. Sometimes if you try to put in an implant to match the size that the person was to begin with, you stretch and stress the skin too much and it doesn't work well. So you put in the expander, you can put it in pretty flat and then gradually stretch the tissues, and then as a second operation take out the expander and put in the permanent implant, which in this case was the form stable or the teardrop shaped implant.
Are all these implants safe for women?
They're absolutely safe. They have been probably one of the most extensively studied devices in medical history.
And you can still get a mammogram? You
can still get a mammogram. You should just tell the technician that you have breast implants and they will do the appropriate mammogram.
Let's talk about Juvederm. This is a product that's also fairly new. What do you use it for?
Well, Juvederm is used to fill in lines in the face, and the latest type of filler is something called Voluma. It has recently been approved by the FDA for volume depletion as we age, for correcting volume depletion that occurs as we age, and primarily in the face,
okay,
in the cheek area, in the upper face. It's a little bit thicker. The voluma is a little bit thicker than Juvederm, so you can go deeper and you can volumize or fill in areas of atrophy. It lasts for maybe up to 2 years.
Oh, okay.
Oh, wow.
It's
Where
quite a while.
Juvederm is not that long, is it?
Juvederm is 8 to 12 months.
Okay. And how natural does it look? Because, you know, we've all seen pictures where somebody looks as though they've had fillers and Botox.
Again, it depends on the technique that you use, but if you are conservative and don't overdo it and inject it in the proper location, it can look very natural.
And a lot of people use fillers like this even to fill in scars or some areas in their face that may have acne or things like that too, right?
Correct. There's fillers that are a little bit less highly cross-linked, a little bit thinner, and they work very well in the surface, in the superficial areas.
So great before and after.
Yeah, it is. I mean, you can tell a tremendous amount of volume gain, and it's a much more youthful look. Really quickly, how do you approach a consult?
Well, I like to have the patient tell me what it is that their goal is. I don't assume to know what bothers them or what they're going to need to have done. And, you know, whether or not we can achieve that and how we can achieve that. In other words, it may be something quick like a filler, something easy like Botox, something you can do in the office, or they may need surgery. And, you know, if they come in not wanting surgery, then maybe, you know, we can do some other things, maybe with not as good an outcome, but meeting their needs.
I bet you make a lot of people really happy.
Oh, yes. Yes. That's the best part of what I do.
Yeah, I think that's fantastic.
It's wonderful. Here's the information so you can contact Dr. Loewenstein as well. Right now, you're located on West North Avenue in Brookfield. The phone number is 212-717-4000 to make a consultation. And if you mention the Morning Blend, you'll get a half-price consultation as well. You can also visit the doctor online at drloewenstein.com. Thanks for being here, Doctor. Appreciate it.
Thank you very much for having me.
Thank you.